Good morning, sir.
Good morning.
How are you feeling today?
Fine, thank you.
Can I know your name, sir?
I am Dr. Parvaiz Shah. I am from Kashmir. I am ex-dean principal Medical College Srinagar. I am senior consultant neurologist practicing at Srinagar right now.
Wow, what a beautiful city Kashmir is, for sure.
Thank you.
Okay, so I would want to know, since Kashmir is so much in hype for obvious reasons that we all already know. So, what about the conditions of Kashmir when it comes to epilepsy?
Yeah, so far epilepsy is concerned, as is true of other parts of the world, epilepsy is very common in Kashmir also. It is predominantly more common in pediatric population than adults. In pediatric population, we get what we call idiopathic generalized epilepsy. Okay, in adults we get symptomatic epilepsy, maybe because of stroke, because or brain tumors, or because of other this metabolic encephalopathies that we call symptomatic epilepsy. But in children, predominantly we have idiopathic epilepsy, which is very much prevalent there. And one of the common causes of childhood epilepsy in our place is cerebral palsy, because these patients get perinatal hypoxia or hypoglycemia, which are two common causes of perinatal brain damage, and they come with symptomatic epilepsy in later parts of their lives.
Right. So, are you also saying that in Kashmir, back in Kashmir from where you are, people are completely okay to come to the doctor and talk about it, or are they still shy? They're not aware of it, that they have to go and talk to the doctor about their problems? What do you say about
A
it?
couple of decades back, there was a taboo attached with epilepsy. Patients, especially female patients, they would not seek attention of a doctor because they didn't want to divulge it to the society because of other social issues. But now things are changing. More and more patients are reporting doctors, and preferably they are going to neurologists rather than to general physicians or pediatricians. Because in Kashmir, health awareness is tremendous, and people are aware. They know where to go. And a patient, whether he has syncope or has epilepsy, they immediately rush to a nearest neurologist.
Wow. Okay, so one more question I would like to ask you here is that how frequent and how actually I would want to ask you which gender goes to the psychologist more when it comes to disbalance of their emotions or psychological disbalance when you're already going through such a problem. So, what do you think? Which gender proportion goes to the psychiatrist more? Who are more open back in Kashmir or in general in India?
To be frank, emotional problems are more common in female sex than in males. Both genders are equally reluctant to go to the psychiatrist at first place. They would preferably go to a general physician or to a neurologist rather than to a psychiatrist. And it is we people, as neurologists, once we refer them to the clinical psychologist or we refer them for cognitive behavioral therapy, they report to the psychologist. But primarily patients of their own, very rarely they go to the psychologist or to a psychiatrist.
But to the audience who's already watching us right now, all those who are already feeling low because of the problem they are already going through, what message would you like to give it to them? How okay is it for them to talk about it?
My take-home message to the audience will be epilepsy is treatable one. All the epilepsies may not be curable, but they are treatable one. And if patients complies with the treatment, we have modern drugs available in our armamentarium. If patients complies with the medication, their outcome of life will be okay. They should not feel demoralized. Yeah, they should not feel demoralized. And they should take due care of seizures. Like they should avoid driving as advised by the doctor for some time, and they should stick to their medication religiously.
Sure, sir. I think those were very amazing words that you just mentioned to the audience. Thank you so much for your words.
Thank you. Thank you.